Hey all, welcome to ShareTreck. This is Raj here, and today I'm going to talk to you about Immatics. As you had seen in the morning show earlier, while we are doing our technical analysis of the genomic stocks, we saw that all the other stocks were weak, but Immatics had a very strong pre-market price action to the positive, and at that time we didn't find any news. So I have some breaking news out here for us to share. So let's get started. Well, friends, welcome back. This morning we have news that Immatics has treated the first cancer patient with the second generation ACT engine TCRT candidate targeting PRAME. So I'm going to explain these concepts to you with these terminologies to you before we get into the meat of the article. So first, let's wade through these terminologies. PRAME stands for preferentially expressed antigen in melanoma. This is the same thing that we have been talking about earlier, that you find an antigen which is predominant in only the tumor cells and use that to create a CAR-T. PRAME refers to that. And it's a tumor-associated antigen that was first identified through analysis of the specificity of tumor-related T-cell clones derived from a patient with metastatic cutaneous melanoma. ACT engine TCRT is an autologous engineered T-cell therapy aimed at inducing a robust and specific anti-tumor attack to fight cancer. So far, this is all the same thing that we have spoken about CAR-T with regard to any other genomic company that's manufacturing CAR-T. However, there's a twist now. CD4 cells lead the fight against infections. CD8 cells can kill cancer cells and other invaders. Let us keep the CD4 and CD8 at the back of our mind as we proceed further into the news article. So now to the news. Immatics preclinical data with IMA203CD8 showed enhanced potency and prolonged anti-tumor activity mediated by activated TCR engineered CD4 T cells. So we have the interplay of CD4 and CD8 out here. That's the key point you have to keep in mind. Now let me take you to the pipeline out here. And we are talking about the cohorts. The first cohort is for ACT engine IMA203 PRAME. So this is the first one, which is mono. The second is ACT engine IMA203 PRAME plus a checkpoint inhibitor. And the third one, which is what is the subject of today's press release, is ACT engine IMA203CD8 PRAME, which is a proprietary. Now let me just go into this IMA203CD8 and show you what it looks like. So this is the schematics that we have in the Immatics website, and we have the ACT product out here, which are these structures, and they are infused into the body. There's the administration of individual T cell product, the ACT product, and T cells directed against the selected tumor cell. Once inside the body, the T cells will go towards the tumor cell attracted by the antigen that they are targeting, and then they get latched on there, and the cytotoxic lytic granules are released, and that is monitored by the CD8. So this is the overall scheme of things when it comes to this particular therapy. Now let's get back into the press release. Immatics announced that Immatics preclinical data with IMA203CD8 showed enhanced potency and prolonged anti-tumor activity mediated by activated TCR-engineered CD4 T cells. So they have done this preclinical activity, and now they are going to use this on the third cohort of phase 1b study using TCR T cells targeting hard-to-treat solid tumors. Here at a glance are the three cohorts that Immatics is working on, and we are talking about using the latest IMA203CD8 the therapy for the third cohort. So let us see cohort A, which is the first cohort. They use IMA203 as a monotherapy at the provisional recommended phase 2 dose, plus exploration of higher doses up to dosage level 5 in the first cohort. In the second cohort, cohort B, they are looking at IMA203 in combination with the immune checkpoint inhibitor Opdivo. So you have the IMA203 along with some immune suppression agents in the second cohort. In cohort C, which is the third cohort, they are going to use IMA203CD8, which is a second generation monotherapy in which IMA203 is co-transduced with a CD8 co-receptor. Immatics plans that to advance the first 3 patients in the study directly to the recommended phase 2 dosage. As per Immatics, the CD8 co-receptor plays an important role during T-cell antigen recognition and T-cell activation, enabling the effective engagement of CD8 and CD4 T-cells in the anti-tumor response. The second generation TCR-T IMA203CD8, which will be used in the third cohort, aims to further enhance depth and durability of anti-tumor responses and clinical outcomes of TCR-T targeting PRAME in patients with solid cancers. PRAME is highly prevalent across several indications, thereby supporting the program's potential reach to a broad patient population for a broad range of tumors. The importance of CD4 T cells for the duration of response has been demonstrated by Immatics in preclinical assays where IMA203CD8 showed enhanced potency and prolonged anti-tumor activity compared to IMA203 alone. These findings are in line with the growing body of literature from CD19 CAR T cells in hematological cancers that suggest a relevant role for engineered CD4 T cells in maintaining durable anti-tumor response over a longer period of time. Immatics' proprietary lentiviral vector enables CD4 and CD8 T cells to be engineered with the PRAME-specific IMA203 TCR and a CD8 alpha-beta construct. I don't know what the CD8 alpha-beta construct means, but basically, as an investor, the main concept I have taken here that the key is that CD4 provides durability and prolonged anti-tumor activity, and that helps the potency of the therapy. As mentioned in my earlier videos on Immatics, I'm still looking forward to data and reports on their bispecifics, and I think we'll get the first data from TCR IMA401. To me, that presents a greater approach to multi-tumors because it's an allogenic approach, and I'm hopeful that it will show a much better results, and it will be much more, I would say, optimum for the company from an investor's perspective in terms of manufacturer deployment and success rates. Just to illustrate the point, let us go back into the pipeline for Immatics, and here is the bispecifics. And I'm talking about IMA401 for MAGE 4x8. Let me just click on this and show you the conceptual diagrams. You can see here, this is the TCER product, which is the T-cell recruiter. And you have a common domain here for T-cell recruiter, and here you have the antigen domain. And this is totally allogenic. And all that the Immatics people have to do, it seems to me, is to just change the antigen receptor out here to the specific antigen that they are targeting that is present in large quantities in the tumor cells that they are targeting. So I'm really thrilled about this one, and looking forward to see any news reports and data reports that come out of Immatics in the near future. And if you go to the pipeline back again, we can see that we are in phase 1A as far as IMA401 is concerned. So I'm very optimistic. And I think this is also another aspect which is boosting the Immatics share price despite difficult market conditions. So no wonder Immatics shares have been strong despite difficult market conditions. Let us check their price action today in the TradingView platform and see if we can get some more clues into the future. If you see the chart of Immatics, we are up today 2.54%. That's not as high as it was in the pre-market action, but still, if you look at the chart, this is a very, very bullish chart. So you had a first bullish channel out here, the second bullish channel out here, and then we had a big spike, and then we had a cooling off. And I'm pretty confident that we are now going to move towards this resistance at 12.71 because our momentum is above average and picking up with plenty of runway before it becomes overbought. And MACD is also turning towards the signal line in an attempt to cross over to the bullish side. So those are all the positives that I see here. However, in terms of volumes, the volumes are coming back to average. When we peaked up, initially we had very high volumes, and then the volumes dropped. Now we are picking back on volumes in the last 2-3 days. The volumes have been pretty good, and I'm expecting the same for today. If we are supported by sufficient volumes for the move today, then I would be very, very confident that the next challenge is going to be 12.71. Overall, I think that's the direction in which we are going. That said, it brings me to the end of this session. So just to summarize all the key points, Immatics is a good company, good pedigree, a good technology that they have developed. The IP they have developed is really impressive. Their approach is also very nice. According to my opinion, it's a clever approach. The second thing I want to talk about is that many companies, many genomic companies make CAR-T therapy. I'm really thrilled about this CD4, CD8 combination, the new approach that they are taking for the third phase, which seems to prolong the life of the T cells and the tumor fighting capabilities. So that will be a plus point. And the most important aspect of Immatics that makes me feel very, very positive about the company and the future share price is the bispecifics. And we will very soon see results of data from the bispecifics because they're allogenic. That means it's going to be much, much easier to manufacture, distribute, administer, and it's easy for the patient. It's the lead time between ordering can also be much shorter. I also believe, I'm not a scientist, but from a investor's perspective, when I look at the schematic diagram that they presented for bispecifics, I think that it will be much easier for Immatics to just swap out the antigen receptor if it was that easy, and use the same platform to target multiple tumors and bring out products in quick succession. So that's my thought process out here. I would be very interested to hear from you guys about what you think about Immatics, and did you find this kind of a presentation easy to follow and consume? Please let me know about that. And if you like this video, I would request you to put a like out there. It helps YouTube promote our channel. And if you're watching this video and have not yet subscribed, I request you to subscribe and help us grow this channel so that we can be motivated to continue bringing you videos on genomics and stocks in general. Thanks and have a great day. Bye for now.